Good afternoon, students. My name is Pankaj Bhatt, Associate Professor at Lloyd Institute of Management and Technology, Pharmacy. Today, I will be speaking about something very important topic, that is pharmaceutical dosage form and prescription in healthcare. We will explore common medicines we are keep at home, their proper uses, storage, and much more. Dear students, medicines play a key role in keeping us healthy, whether it's for curing an infection or managing a long-term condition like diabetes. Medicine are an important part of our lives. So in this session, we will understand not just the types of medication, but how to handle them properly and safely. So students, prescription medication. So prescription medication are powerful and specific to certain conditions. Since they are tailored for individual needs, it is very important to follow the doctor's instruction exactly. Right dose and right time. Misuse can reduce their effectiveness or cause harm. Now, common prescription medications. So students, some examples of commonly prescribed drugs include antibiotics like amoxicillin for infections, pain relievers such as morphine, and blood pressure medication like amlodipine. These are not medications we take lightly. They need to be handled with care. Next one is OTC medications. OTC medications are more accessible and mean for common problems like headache, cold, or acidity. But just because they easy to get doesn't mean we can be careless. It's important to follow the doses instruction and make sure they don't interfere with other medications you might be taking. Next, common OTC medications. So students, ibuprofen, paracetamols are typically pain relievers. During a cold, you might use decongestant like oxymetazoline or antihistamine like cetirizine. Antacid like Digenes are also common for indigestion. These are everyday medicines, but they should be used responsibly. Next, supplements. Supplements are products we take to fill gaps in our nutrition. They are not usually for treating diseases directly, but they help in overall well-being. Things like vitamin D, calcium, or herbal extract such as ashwagandha falls into this category. Common supplements. To give you an idea, vitamins helps in immunity and body function. Minerals like calcium helps in bone health, and herbal supplements like karela, jamun juice support sugar control. But even these should not be overused or taken without proper knowledge. Storage of pharmaceuticals. So, students, storing medicines properly is just as important as taking them properly. They should be kept in a cool and dry place, away from sunlight and moisture, and of course, out of reach of children. Never store them near food or chemicals. Now, temperature, light, and organization. Most medicines are best stored between 15 to 25 degrees centigrade in their original containers that protect from light. Some should not be kept in fridge unless advised. Keeping them organized by type of expiry helps avoid confusions. Now, expiry date and disposable. So, students, every medicine has an expiry date, which tell you until when it is safe and effective. Expired medicines should never be consumed. When disposing, don't throw them in the bin or flush them. Use a pharmacy take back program if available. Now, reading labels. It is always important to read the label before using any medications. The label tells you about the active ingredients, how to use it, what to avoid, and possible warnings. It's a small step but can prevent big mistakes. Now, doses instructions. So, students, stick to the recommended dose, not more and not less. And be careful while measuring liquid doses. Using a spoon from the kitchen is not accurate. Always go by what's mentioned on the packaging or prescribed. Now, side effects and interactions. Every medicine has a chance of side effects, from mild ones like nausea to serious ones like allergic reaction. Some medicine can interact with other or even with food. For example, dairy can reduce the effectiveness of certain antibiotics. Now, child safety. Children are naturally curious and medications can look like candy to them. That's why child-proof packaging is essential. It is also important to teach children not to touch or eat many things without adult supervision. Now, trends in home pharmaceuticals. Now, we are also seeing some existing development like a smart pill dispenser that remind you when to take your medicines and personalized medicine based your genetics. Technology is helping us make medication safer and smarter. So, student, if you found this session useful or learned something new today, so give it a thumbs up and don't forget to subscribe for more such practical and informative content.